April, nice to see you.
Bobby, back so soon?
Yeah, my feet this time.
What happened to your shoes?
There's this new guy at the shelter. He needed winter boots. I still have my slippers, though.
All right, this is a tetanus shot. Is that okay?
Oh, anything you say.
Okay, thank you. All right. Bobby, you shouldn't be giving away your boots, particularly in January.
Oh, I'll manage. I always do.
How did you manage last week after you gave away your gloves?
Frostbites, all healed.
You're too much. All right, soak your feet. I'll be back to check on you.
Okay, thanks.
I'm looking for a Robert Parker.
Bobby's in treatment 3. But who called for a psych consult?
The attending, Dr. Mobit. Why?
I know Bobby. Treated him for a month now. He's just really kind.
Huh. I guess there's some concern that he can't take care of himself?
Because he gave some clothes away? He just likes to help people.
Just gonna have a little chat. How long you been living at the shelter, Bobby?
About 2 months now.
And where were you before that?
At home, Lincoln Park.
Oh, nice neighborhood. Shelter must have been quite a change.
I don't mind. The people there need me. I don't have much anymore, but what I do have, I'm happy to give.
And what prompted you to make the move from Lincoln Park?
It's my wife's idea. She said I was giving away all of our savings, bankrupting the family. She didn't know what happened to me, why I changed.
Tell me how you changed.
I used to be a regular guy. Corporate job, a house, a couple of cars. One morning I woke up and I realized that the only thing I wanted to do, the only thing that mattered, was helping other people, giving whatever I had to them.
Any idea of the source of this inspiration?
You mean, did God talk to me or an angel? No, I just knew inside.
Dr. Charles, I heard Bobby was upstairs getting a CT.
Yeah. Just want to rule out any organic cause for his behavior, that's all.
You think he's crazy?
You mean like delusional or psychotic? Not at all. Quite rational, in fact.
Then why the CT?
Actions are a little obsessive, if not compulsive. You know, giving your shoes away in Chicago in the middle of the winter. You've taken quite an interest in Mr. Parker, haven't you?
Yeah, I guess I have. It's... Never mind.
Try me.
St. Francis. He reminds me of St. Francis. I was raised Catholic. Growing up, we had this little statue of San Francisco in the garden. Of all the saints, he was my favorite. He gave away all his money, all his possessions to the poor. Took care of the sick with no thought of himself.
Remarkable fella.
I'm not saying Bobby is an actual saint, but saintly, yeah.
We just want to make sure we're doing the right thing by him, that's all.
Yeah.
Hey there, Bobby. Got your CT results back. I'd like to go over them with you if you had a sec.
I can finish this later.
No, stay. It's fine.
So, when we talked before about the change you experienced, you said that it was sudden, happened overnight.
That's right.
The abrupt nature of the change made me wonder if there might be a physical cause. So here, I want you to take a look at something. This is an image of a typical brain, and this is yours.
Why does it look different?
Because you, my friend, had a stroke.
I know stroke victims. They're crippled or can't speak.
There are actually many different kinds of strokes. Yours caused lesions to form in the frontal lobe. That's the region of the brain that controls, among many other things, behavior and judgment.
So you're saying I'm brain damaged?
I'm saying that in your instance, the stroke didn't cause any physical impairment, but it did cause you to become what clinically I would describe as pathologically generous, making you compulsively driven to give.
So I help people because of damage to my brain?
Basically, yeah.
But it feels good. It makes me happy.
Makes sense?
I don't want you to fix it.
Well, That's fortunate, because truthfully, even if you did, aside from some behavioral therapy, we can't.
Okay.
Okay. I got back in touch with the shelter. They're happy to have you back. In case you didn't know, you've become something of a star there. Do you mind if I share some details of your condition so that they can help take care of you?
Sure.
Great.
Now, you gotta promise not to give these away.
Okay.
Or any other pieces of clothing. I don't want to see you back here.
I promise. I'll be...
Bobby? Bobby! Dr. Troy! He's choking.
Let's roll him on his side.
Bobby suffered another ischemic stroke, much more severe this time. His judgment remains impaired despite the medications we've given him. And we have noticed further changes to his temperament.
What kind of changes?
They're profound. I've contacted DHS, and they're going to provide a guardian who can help Bobby get placed in a state-funded nursing home. I'm sorry, April.
Hey, Bobby. Here, let me fill that for you.
It's mine.
I just want to fill it up.
It's mine.
Okay. He's gone. The Bobby I knew is gone. I mean, maybe he never really existed. I wanted to believe that self-sacrifice came from the soul.
And not lesions on the brain.
I mean, what if there's no such thing as saints? What if Mother Teresa, Gandhi, St. Francis, they all just were people who suffered a stroke to the frontal lobe?
Who knows? Theories abound. As a shrink, I'm supposed to tell you that we project saintly qualities onto others because we need to. Makes us feel hopeful, safe. But this I know for certain. Whoever those people were or weren't, they absolutely understood the power of a simple act of human kindness.
I guess I'm just trying to figure out what to believe in right now.
I don't know. Sometimes I think proof's all around us.
You're almost there. You're doing great.
You just gotta remember where to look.
No. We took him to the ER after the game. He was scanned. They tested him. He said he was fine. No concussion. It's got to be something
You
else.
hound me for my opinion, and then you question my diagnosis. Cool. ER obviously screwed up. Kid's got a concussion.
I had double vision before I was hit.
Well, that changes everything. You need glasses. That's why you had double vision, which is why you got hit, which is why you have a concussion, which is why you have night terrors. You need to see an ophthalmologist, which I am not.
You enjoyed that. I brought a reasonable case to your attention, and you shoved it in my face just to humiliate
You're an
me.
only child, aren't you?
Why would you say that?
Because everything is about you. This may seem incredibly controversial, but I think sexual abuse is bad. I just wanted to make sure he wasn't being diddled by daddy or mommy. Anything else is just a bonus.
I'm not an only child.
Interesting.
What?
Don't move. Did I bore you in there?
What? No, not really.
Are you tired?
Sometimes.
He never sleeps. Of course he's tired.
Right now, at this moment, are you
No,
tired?
no.
That twitch in your leg. Did you feel that?
Didn't hurt.
His leg twitched. I don't see what...
It's called a myoclonic jerk. It's very common when you're falling asleep. Respiration rate falls, and the brain sometimes interprets this as the body dying, so it sends a pulse to wake it up.
So?
So, he's not asleep. He's awake. Admit him.
I usually don't move during night terrors.
I'm not restraining you for them. EEG revealed abnormalities in your brain, caused nerve damage in your toes.
What are you doing?
Fixing it.
Can I talk to my parents?
Oh, they know all about this.
I'd really like to see them. Please. I really like them here.
This is gonna hurt, Dan.
Oh, God.
Dan, you okay? There are experimental treatments, ongoing research. Who knows what they'll discover in a year or two?
This is where I dropped the ball.
Dan, we're standing on the roof of the hospital. Dan. Dan, you're not on the field.
He doesn't know where he is.
There, Foreman. Dan.
Dad?
Dan, no!
Dad!
Show of hands, who thinks I'm not in my right mind? And who thinks I forget this fairly basic neurological fact? Who thinks there's a third option? Very good. What's the third choice?
No idea. You just asked if I thought there was one.
The patient has a shunt in his brain. There'll be no increased pressure. We can put as much penicillin into his body as we want.
Excellent. Inject him through a lumbar puncture.
I heard you found her on the roof.
You have very acute hearing.
You notify the parents?
In due course, of course.
And is there a paternity bet on the father of the patient?
Doesn't sound like me.
Well, it does, actually, but it doesn't mean you're guilty.
You think?
I saw the parents in the lobby. Smart money's obviously on the father.
My guy knows a guy who can get you in for $50.
Fine. Tell your guy if I win, you attend the faculty symposium and you wear a tie.
And if I win, no clinic hours for a week.
My guy will call your guy.
She's very good at her job.
How can you just sit there?
If I eat standing up, I spill.
Our son is dying, and you could care less. We're going through hell. You're doing nothing.
I'm sorry, you need to vet, I understand.
Don't be condescending. You haven't checked in on him once.
Blood pressure is 110/70. The shunt is patent, well placed in the right lateral ventricle. The EKG shows a normal QRS with deep wave inversions throughout both limb and precordial leads. LFTs are elevated, but only twice the normal range. Oh yeah, and he's hearing voices. Go hold his hand. Go on, I'll bust your tray. Got any sample bags on you?
I don't believe you. Gonna run DNA tests?
Your son is deathly ill. I know, it's terrible. The fact is, if I don't keep busy with trivial things like this, I'm afraid I might start to cry.
You're an ass.
Yeah? You want to double the bet?
I need an answer.
You idiots. You lied to me.
We didn't lie about anything. You, on the other hand, accused us of molesting our son.
Perfect.
Couldn't we get off my screw-ups and focus on theirs? Theirs is bigger. You're not Dan's parents.
We're his parents.
He was adopted. He doesn't need to know.
I do.
Adoption makes us just as much
Listen, when we were taking his medical history, were you confused? Did you think we were looking for a genetic clue to his condition, or did you think we were trying to ascertain who loves him the most in the whole wide world?
How did you find out about this?
I sampled their DNA.
We wouldn't give you any DNA.
Your coffee cups from the cafeteria.
You can't do that.
Again, why are we getting hung up on what I did? Your medical history is useless.
No, we gave you a detailed history of his biological mother.
Her history. Non-smoker, good health, low cholesterol, no blood pressure problems.
Dan was adopted 2 weeks after he was born. You have his history. There's nothing you need to know that we didn't tell you.
Sounds reasonable. Well, if you want to transfer your boy, that is your choice. I still think it's wrong.
Was she vaccinated? The biological mother, when she was a baby, did she get her vaccinations?
Dan was vaccinated at 6 months.
Mm-hmm. Do you know why kids get vaccinated at 6 months? Because before that, they are protected by their biological mother's immune system. So, was she vaccinated?
An infant picks up a regular old measles virus.
He gets a rash. He's extremely uncomfortable, has a wicked fever, but he lives. Here's the kicker. Once every million or so times, the virus mutates. Instead of Dan having a fever and a rash, the virus travels to his brain and hides like a time bomb. In this case, for 16 years.
Subacute sclerosing panencephalitis.
I know. There's only been 20 cases in the United States in the last 30 years.
Suppose you can make an argument the kid's still in stage 1. Once SSPE moves to stage 2,
boom. Stage 2 is universally fatal.
I assume it's impossible to know when he might move into stage 2.
He's already started showing symptoms. Could be a month, could be tonight.
Can we treat it?
Ask the neurologist.
Intraventricular interferon.
Not going to shove a spike into his brain and drip interferon without confirming this diagnosis.
Tap him.
We won't get a reliable result for measles antibodies in his CSF, not after everything we've given him.
So the wrong treatment kills any hope of the right diagnosis. Why do people lie to me? Could also kill him. You're a ball foreman. Tell me I don't have to biopsy his brain.
Well, there is one other way.
You sure this isn't gonna hurt?
Yeah, it's just scary as hell.
See, we go through the pupil.
You won't feel it. The eye's been paralyzed. The needle travels to the back of the eye, which is where we'll perform the biopsy on your retina. So we've confirmed that the problem is this mutated virus.
Did you need something else?
Good news on your EEG. Treatment is working.
And your immune system is responding.
I know it's early. Just want to take a look. All right. Let's see what that brain of yours can do. Name as many animals as you can that start with the letter O.
Ostrich. Ox. Old elephant.
Well, it's 2 better than last time. How you doing with the whole adoption thing?
Been here since 5th grade.
How's that?
Cleft chin. I have one. My dad doesn't. Looked it up on the internet. It's one of those trait things.
That's right. It's autosomal dominant. Since neither of your parents have cleft chins, it's highly unlikely you're biologically related.
You sure you're okay?
I've got no problems with being adopted.
Grab a sheet, will you?
EMS just dropped off.
Wait,
What?
do you hear that?
Hear what? Dr. Bloom, she's dead. No pulse, no BP, cyanotic rigor mortis.
I need a defib ventilator, ALS, and resuscitation team, now.
That's impossible, she's dead.
Well, at least you didn't kill her twice.
Good afternoon, Mr. Martin. I'm Dr. Vijay Kapoor, your wife's neurologist.
What happened to her?
Let me first find my glasses so that I can read her chart properly. Oh, here they are. Thank you. Presented cyanotic and rigor mortis, administered diazepam and Valium. So, Mr. Martin, it appears Patricia's brain convinced her heart that she was dead, even though she was very much alive. We are going to perform a few tests to find out why. In the meantime, you and I are going to talk. Talk about your life together, how you met, how you live.
What does that have to do with what happened to her?
Everything. Your husband said you were taking haloperidol.
For 2 years, for depression.
And last year you were diagnosed with Parkinson's.
Does any of it explain what is happening to me?
Not yet. I'm going to run some more tests and hopefully...
Yes, but she's in pain, and she's not getting any better.
Mr. Martin, I need some more information before I can make a diagnosis.
How can you not do something for her?
We are going to do something. We are going to keep talking. Where are my glasses?
I asked you to keep me in the loop on 1208.
I needed to conduct thorough patient
I'm taking
history.
the patient out of your service.
Because?
Because you should have made a presumptive diagnosis. Because you should have aggressively treated the Parkinson's.
Except she doesn't have Parkinson's. PET scan. Small black flecks over her heart.
Artifacts.
Look closer. 2 years ago, Patricia was misdiagnosed with depression. She was prescribed haloperidol, which caused stiffness.
Right.
As a result, she was misdiagnosed with Parkinson and prescribed levodopa, which made it impossible for her to sleep. So she was prescribed hydroxyzine. That toxic combination caused both cardiac arrest and rigidity. But this whole time, her true symptom was her immune system fighting a tumor which nobody could see. Small black flecks.
Malignant thymoma.
If I continued treated her for Parkinson, she would have another cardiac arrest and died. By taking my time, by slowing down, I bought her another year. Maybe 2.
How can I help?
When she wakes up, you can help me tell her she's going to die.
My fish isn't bad.
But it's not great either, I'm sure. I warned you against the snapper.
Do you think it'll calm down?
God, I hope so. That guy is a bit of a blowhard, though, isn't he? The food's not spicy at all. You can barely taste it.
Mine's pretty spicy. Try it.
I don't taste anything.
Have you been throwing rolls at me?
It wasn't me.
Really, he didn't.
God, I'm sorry someone would choose to behave that way. Really, I'm so sorry. Really, really, really sorry. No. I swear. It's not me.
Just warning you, in a good mood. And largely pain-free, so I've got no idea how things are going.
Alien hand syndrome.
Set off by a stroke? Or is there a pony in the backyard?
Split brain. Right hemisphere controls the left and...
It's making life miserable. Non-logical thinkers often do.
Current issue isn't the split brain. The surgery corrected.
You're dissing the right hemisphere? Most people who have this operation don't even notice they're missing anything. Left brain has language, arithmetic, rationality. Right brain is a mute loser.
Right brain is more aesthetically oriented, has greater facial recognition. I couldn't have been a plastic surgeon without it.
Yes, and where would junior high be without our ability to judge people on aesthetics?
Right brain's also more aware of the present moment, our place in the universe.
It's a universal daisy chain of peace and love. Throws buns at people.
Hey. Great. Did you find my MP3?
Not yet, but I got your shaving stuff, toothpaste, deodorant, some magazines, and this cactus from your window.
Look, you didn't have to do that, really. The hospital supplies all that stuff.
I'm still trying too hard, huh? Trying to get your other half to like me.
No. Don't say that, okay? I like you, which means that we shouldn't read into that.
Antifungal meds? Ordinarily, we'd put them in your IV, but since your right brain doesn't seem too fond of IVs, you should be feeling better in a few days.
I have to get back to work. Rick says your shift will be waiting for you when you get back.
Thanks. Oh my God. God, I'm sorry. I'm so sorry. I'm sorry.
I have to get back to work.
Babe, wait, hold on. No, it wasn't me. I can't walk.
Any image that appears on your far right will only be seen by your left brain, and any image on your far left will only be seen by your right brain.
Okay.
Just start by saying the words.
Book, giraffe, willow, fortunate.
You're not saying the word.
I didn't see a word.
Could you draw a picture of what you think the word might be?
Look, I didn't see. Candle. This is so cool.
Yeah, that's not freaky at all.
No communication. So far.
Scott, why are you standing?
I'm a little chilly. I thought I'd get a sweater or something for my room. Is that okay?
Just a few more minutes.
And that, ladies and gentlemen, is the left hemisphere. The side that's obsessed with finding answers. The one that needs things to make sense. The interpreter. That's where we tell the story of who we are and why we do things.
That's also the side that was wrong. Right brain's advantage is that it isn't logical, doesn't choose which details to look at, makes connections you could never see. You owe your insight to the mute loser.
I'll send it tickets to a Phillies game.
Confabulation means no communication, means your theory's wrong.
But he is cold. Why are you scratching?
It itches.
Ammonia breath. Your liver is failing.
So, your left hand would rather play air guitar than give me a hard time? Rather play air guitar than tie shoes, eat dinner?
Your right hand's playing too.
I don't want to discourage you.
Splinter hemorrhages under his fingernails.
What's that? BP and O2 stats are dropping.
Need a bag of B negative in here.
Where are you going? Annie called. She's not coming back.
This is not the best time.
Look, you said the heparin would keep new clots from forming.
Maybe, but something's obviously causing the
If
clots.
you have pancreatic cancer...
We're not trying to scare you, but even in its early stages, the fatality rate...
You walk out of here...
Stop!
and- Look, I'd ask you to put yourself in my place, but nobody can put themselves in my place. Did she find somebody new? Was I not being attentive enough? No. She's just tired of being insulted by a limb. She said that my feelings toward her were mixed. Well, my feelings aren't mixed. You're not going anywhere. Unless you want to go naked. Your right brain knows you need to stay. My right brain's an ass. Is the guy out there? The guy that's gonna make my right brain work?
Oh, What do you think your right brain wants?
How should I know? It's crazy. It does things I would never do. Ductive worsening slightly enlarged, but within normal parameters.
Say something.
It's mute. It can't communicate with you. Maybe you should try communicating with it.
Talk to her. The well isn't deep, is it?
You're the dominant half. You make all the decisions. The right side has no control over anything. Must be frustrating.
No masses in body or tail segments. I can't communicate with it. That's the whole...
When you decide to go and get groceries, what do?
What do you mean? I put on my jacket and I go to the store.
Your right brain has no idea why you're suddenly getting up and putting on your jacket. It just gets dragged along. Next time, try saying it out loud.
Just say to the empty air, hey, I think I'll go to the store because we're out of peanut butter. How much did they teach you about people like me when you were learning to be a therapist?
I'm an oncologist.
The right brain likes what he's saying. Hasn't moved the entire scan.
Hasn't gotten us anything, though. Scan's clean. It's not pancreatic cancer.
Clots aren't from cancer. They're coming from his heart.
We echoed the heart, no clots.
Not while we were looking. Didn't I open with that? The clots were caused by an arrhythmia.
No arrhythmia.
Not while we were looking. Intermittent arrhythmia. This guy pulls our equipment off, slightest provocation. We'd have to be watching the exact moment it happened, which I'm guessing, the way you two are scrambling around like idiots, is right now. Yes, I'm saying do a transesophageal echo.
We have to get his BP stable.
Absolutely. Right after the echo.
Systolic 70.
The heart looked healthy at the last echo, and an arrhythmia would cause clots in a healthy ventricle. Start with the left atrial appendage.
Wow.
Yep. They did it again. Now get this poor guy's BP under control and seal off the appendage. Then all we have to do is find out what damaged his heart before he goes after something he really needs.
Annie.
You hit me.
I know. I'm so sorry, but it wasn't me.
I know you would never have done that if you were in control of yourself, but
you came back.
to talk with your doctors. I've been going over and over what happened, and I had this thought out of nowhere. Ever since I've known Scott, I've seen his left hand throw things, but always sort of playfully, thinking it's fun. But when he threw this, it was angry. And that's when his hand slapped me, too, when I brought it to him. Could it mean something?
Deodorant shouldn't. How often do you use it?
A few times a day. It's special heavy-duty stuff. I have to send away for it.
Sprayed around a bathroom the size of a shoebox.
I'll check the ingredients from the manufacturer.
I'll check for any references associated with health issues.
Somebody's grateful.
We'll just leave the three of you alone.
The deodorant has a high proportion of propylene glycol. Same stuff made a kid in Singapore develop a heart condition and, get this, seizures. Our patient may never have needed split brain surgery.
I'm sure he will half appreciate the irony. Take this man to radiology, pancreatic scan, and stay with him.